Hello, my name's Peter DeLissa. I'm one of the surgeons at Veterinary Specialist Services. Today I'd like to talk to you about what happens to your dog or cat when they get referred to us for management of a fracture. So initially what will happen is either your referring vet or sometimes the emergency service that we work with will recommend that your pet is treated by us for their fracture. Initially, we will have a consultation with you and go over what we have seen on our examination of the patient, and also any radiographs, X-rays that your vet has taken to help evaluate what initially we think is the best way forward. Following on from that, we will have a discussion with you about some of the treatment options that we can provide for your patient. So, first of all, that might involve discussion of the severity of the injuries. Firstly, that might also involve management of some of the more severe life-threatening parts of that injury as well before we manage the fracture. So after those are stable, however, what we will then need to do is discuss what we need to do in regards to management of that fracture. Things we need to take into account for that include what sort of fracture it is, whereabouts it is in terms of what bone, and where it is in relation to other things like joints and other vital structures. Using that information, we help decide in conjunction with you and potentially further imaging that we might need to do, what the best options are for managing that fracture. We have several different options with regards to implants that we have to stabilise fractures. The most common one we use is probably bone plates and screws. Those are usually quite versatile and can be used to manage many different types of fractures. We also have the option of interlocking nail, which is another type of fracture repair, and also external skeletal fixation. Those two have slightly fewer options for management. We use them less frequently, but in specific instances we do like to use them. We also have specific fractures, particularly ones that are close to the joint, where we may actually use just pins and wires to stabilise the fractures, which is because the fragments themselves are so small. And following our discussion with you about the treatment options, we will generally organise your pet's anaesthesia to have surgery, followed by the surgery itself, and then during that recovery period after surgery, your pet will be in hospital with us, typically for 1 to 2 or 3 days, sometimes longer if they are seriously injured, in which time we'll provide pain relief and general nursing care that is required. And also, once your pet is ready to go home, we will provide you with detailed instructions on how to care for your pet when they're at home, and also information about any required follow-up checks with us or with your regular vet. During your consultation, we will also discuss with you the likely outcome, and in terms of the chances of complications, and also the degree of improvement that we'd expect, and the overall outcome with regards to level of function and comfort. If you have any further questions regarding fractures in your pet, please don't hesitate to contact us at Veterinary Specialist Services.